So my guests today are Dr. Jeep and Vanessa. Hi, you guys.
Hi, Roxanne. How are you doing today?
I am not bad. How about yourself?
Really good. Nice day here. Cold, windy.
All the things that winter brings, for sure.
Like,
Now, you guys have written several articles for Physician Outlook magazine, and they're going out in print very soon. And I noticed one of them, and I laughed because it was marriage bread or something to that extent was the title of it. And all I could think was, a really good sandwich is like a good marriage, right? Like your example made perfect sense.
absolutely. Making bread is, you need eggs, you need flour, you need yeast, you need water. I mean, they're all equally important, and you can't really do it without anything, but really probably the most important thing is water. And so if you use too much, it's going to get it's going to be too soupy. The bread's not going to work out very well. And in marriage, I mean, respect, communication, compassion, empathy. What are all of those underneath them? Love. And if you don't have love, and it's the same thing with water. You can put a little bit in there, but what you put in is what you're going to get out. The difference in water and love is you could put not enough, but you could never put in too much. And the more you put in, the more you're going to get out. And I just think the comparison of those two things. Just one day I was thinking about content to write, and that came up, and there I went starting to write it, and it worked out pretty well.
I would agree with that. I think, anyone watching this should go grab that issue of the magazine and take a moment to read it, because it really hits home, that one. Any words of wisdom for, gosh, I couldn't imagine being a doctor with a disability and dealing with like all of that together. Hard enough. But what words of wisdom would you impart on someone who's trying to save a marriage and might be dealing with pain and all of those different things?
Well, Vanessa, especially if she's having more than 1 or 2 days, as she would like to say, I start to rewind those bad tapes. That you start to go down the rabbit hole, and you start to think, oh, well, I was doing really well up to now. Are things changing with my diagnosis? Is this the way it's always going to be now from now? And I dealing with, I'm sure that when you have a length of time that this is going on, that's a little different, and you're thinking, is this a change? Is this the way it's always going to be right now?
Is it going to get worse?
I don't know if I can deal with this. It's so good.
Vanessa.
Yes.
Which accommodations were harder for you to make? The mental ones for your disability or the physical ones?
Definitely mental, because he would explain to me, and maybe you might understand this, when you're in pain, there's a large part of your brain that's diverted just managing the pain. And so what happens to go down with that is mood. Pain affects mood. So absolutely, dealing with the mental challenges have been far more difficult than dealing with the physical ones. But I include pain in there with mental too, because it would do a number on me.
So part of what you do as a spouse is you sit them down, and first of all, you say to them, listen, I love you for who you are. I love you with this diagnosis. I love you on your good days. I love you on your bad days, especially on your bad days. You are worth it, even with what you're dealing with. You're my best friend. You're my companion. You're the mother of my children. You're my wife or husband. And that sort of positivity and support is crucial in dealing with something like this, because she's been dealing with this for so long. It's better now for a number of different reasons, but it still goes on. And so we've been together now 31 years, married 29. And in the early stages of this diagnosis, it was really hard. Is it as hard now? No, but it's still there. So you have to continue those that advice of affirmation to your spouse. So the last thing that they should ever have to worry about is you not being there.
That is an excellent point. Yes, I never had to worry about that. I always knew he had my back on my bad days and on my good days. What I tried to pay attention to and be particularly cognizant of was the fact that I never wanted to use my disability as an excuse. And I never wanted to use it as an excuse to not, to not be the type of wife that I wanted to be for him. I never, I didn't want it to be a codependent type of relationship, so that if I was in, not feeling well, that it was going to pull him down. And it did not. And I think, a lot of that goes to him being a physician, because he understood. And I think that's a big part of it.
And I think as a dovetail to that, our 3 kids have grown up knowing what Vanessa's had to deal with, and it's made them better people, because they understand what it's like dealing with somebody that's got a chronic illness. And we were in a unique situation because I knew what it was, and if they ever had questions, they could come to me and say, like I would get Mommy, why, or Daddy, why does Mommy feel this way today? Well, why? It seemed like this has been going on longer than it normally does. What's going on? And so I would be there to break it down for them and explain to them, and then they understood, and they could approach Vanessa like if it was a really bad day and she wasn't able to get up off the couch, then they either came to me for help, or they learned, okay, this is a bad day for Mom, so I'm gonna do this myself, or I'm gonna help, or we're gonna help each other do what we need to do, because this is really a bad day for Mom. And so it taught them so many different things. Did they hate seeing their mom dealing with what she did? Yes, but the best thing that I can talk about my kids, 2 things, is they're all really good people, and they all have big hearts. And a lot of that is because they have seen how we dealt with that and what she deals with. And it's really been a positive reinforcer for them, for sure. The book is The Labor of Love. I was raised in a household with, my father was a physician. My grandfather, who I never met before him, was a physician. And I knew a lot of physicians who were married. And I felt that, my parents didn't have a good marriage. And marriage was something that was always very important to me, even at a young age. It was, I saw how they fought. Most arguments were instigated by my father, and took advantage of a lot of things, as he will freely admit. He's probably the original male chauvinist pig, and he had this attitude that what my mom did to raise 5 kids, take care of a house, keep the house clean, to go out and do the grocery shopping and all of that didn't register in his brain that was a hard job to do. And whatever he did was always more important than that. And so there was a lot of screaming, yelling, verbal abuse. occasional physical abuse, and I'm like, there's just no reason for this infidelity. And so I saw this from other physicians, and I got through the years. I said, I always wanted to be a doctor, became one, and Vanessa came into my life, and this is not going to happen between us. So
Let me pause you right there. Are you saying that to be a doctor equates to spousal abuse? Or are you saying that not all doctors fall down that path, but...
That's a very good question. And no, I don't mean that. What I mean is that being in a physician marriage, whether you are the physician who is a wife or a husband, the stresses in a physician marriage are quite a bit different than what for lack of a better word, what a general marriage is in society. Every marriage has their own issues that they deal with and their own stresses. But being a physician, you are, especially in this environment right now, you deal with oftentimes a different stressor every day, whether it's the administrator says you need to take this amount of time on this day, not knowing about it, to do something that you weren't expecting, or you are dealing with something at the hospital that's happening as a result of COVID, or you have an unexpected meeting or a patient that goes bad. So it's not a 9 to 5 job. It's not even a 9 to 7 job. And sometimes it's not even a 9 to 9 job. And so there needs to be a certain amount of understanding going into this from the physician and the spouse. And that understanding only happens with a considerable amount of directed communication between the two of you. And in a lot of times that communication needs to be scheduled, because when earlier part of our marriage, she was raising our kids. I was helping, but she was doing the most of it. And then taking care of the business side of the practice, and I was working. And early part of the practice, I wouldn't get out till later. And sometimes, because I went to so many hospitals, I was rounding until 12 or 1 a.m. And so that's a heck of a lot for your spouse to have to deal with on a regular basis, especially when there are kids involved. And then there's a story that we talk about, and we have used in our coaching, and that is that I would come home after oftentimes a 12-hour day, and my brain is not my own at that time. I'm spent. So all I want to do is walk through the door, go to my lazy boy, sit in there and look at the TV and just veg out. Meanwhile, Vanessa is in the kitchen getting dinner ready. Our 3 kids or 2 kids, whatever it was at the time, are walking around, clawing on her, wanting this, wanting that, and I'm over there in the chair just not attentive to anything that's going on. And she has done the business of the practice, then goes pick up the kids, brings them home, and so she's dealing with 2 jobs at once, and I'm dealing with mine. What she does is equally as important, but how I handle that situation sometimes is not giving her the understanding and respect that she deserves of doing those 2 jobs.
Mm-hmm.
So after a while, she was like, hey, we have 2 kids. You said we bring these 2 kids into the world. You're going to be a part of that. and so basically what we decided to do to fix the problem was I would come home, I would take an hour of just vegetating and not thinking about anything. Usually we would eat dinner, and then after that, then she would sit down, tell me about her day, and then we would both spend time with the kids after that before they went to bed. Usually one's given the bath, and somebody else is reading the story or something like that. These are things that, if you don't pay attention to them, are going to split you apart, especially if they go on for a long period of time.
And they're insidious. They're,
Good
you know,
word.
you just keep going along with the life, and then one day, boom, it just, you know, your spouse is not happy because you've spent so much time just trying to get through the days and get through your job that you didn't have time to make a life. And I would say fortunate enough for me. Was it hard? Oh my gosh, it was absolutely hard. I mean, the only time that we all had dinner as a family is when we would, you know, make restaurant, you know, like, okay, you know, schedule, like, okay, Friday night, we're going to go out for dinner. And then we all sat there. We went out to dinner a lot because that was a time when all of us sat together. It wasn't going to happen between Monday and Thursday. Just wasn't going to. And, but I guess I had an understanding, and I empathized with him. When he came through the door, I know he was tired. So there was, you know, in me, caring, understanding, empathy for him. I think that helped out a lot. I think spouses hopefully need, you know, if they don't have a whole lot of understanding for that, maybe, you know, think about how that relationship could be, you know, talk about what can we do to make this better? What can we do so that we're both happy with this?
If you're not talking about this kind of thing before you get married, and you just think, oh, well, when I put that ring on her finger, or I put that ring on his finger, it's going to be different. Well, it's not. So these are the kind of things that you have to talk about. Okay, honey, you know, I'm still in my internship, I'm still in my residency, or this is the first part of, you know, a job that's going to last me a lifetime. And when you're starting out and you're getting known, you know, it's not just a matter of putting out your shingle out there. People need to get to know who you are. So a lot of time needs to be put in there. And so that is something that you need to talk about. So the other person who is going to be in this relationship with you understands that. And if they're not willing to understand those sacrifices that need to be made, then, you know, thinking it's going to change is just going to cause you more issues than you ever thought was going to happen before you get married. And we see that things that are talked about superficially, deep things aren't talked about before marriage, and they crop up, and there's so much huger, and we've seen so much of it out there, but we have this fire in our hearts to make these marriages better, because despite obstacles that happen, it doesn't mean that you can't get through them with, you know, a teamwork type of atmosphere. And if you don't have that teamwork, and if you don't have that ability to communicate with each other, it's not going to work. And
just makes it harder.
Oh, so much harder. But like I said, it just doesn't have to be that way. And so the book, to get back at that, is a way of reading. And in the book, we have 3 different marriages that are talked about, and issues that were brought up in each one, and how what we have used, that it's been effective for us, how it's worked, or looking back, because one of the marriages was from a different era back in the early 1800s, that if the tools that we use had been used back then, problems that they had to deal with at that time because of the year that they were living. Had this been done, could have ended up having a different type of outcome. And so it's a how-to guide, but it's a how-to guide that is fraught with good outcomes.
Lots
Good
of
outcomes.
tools.
Lots of tools.
Lots of
that
tools in
are
there.
helpful.
Mhm.
You know, we've had a lot of obstacles that we've dealt with throughout our marriage,
Yeah.
and it's some pretty big to have to deal with, but it's the attitude that you take with that. And if you don't work on your marriage regularly, when things like this come up, it's going to be more difficult for you to deal with. You can plan for things, you can make decisions of the future, but what happens to get in the way of that is life and things that you could never ever plan for. And it's the ability to get through those times that really define who you are as a married couple. And that doesn't come just naturally. It's something that you have to work at, especially in what we, in the environment we are in the medical field. So I would say that's probably the biggest thing. As far as our book, you can go to our website, which is www.bestfriendsagain.com, and our book's available there. And also we have a program that we have for married physicians that is geared towards them, that gives them tools from getting more clarity about what they need and want, and going through the program, getting to the end, a deeper level of connection that they could have ever imagined in between. And it's results driven, it works. And we want, bottom line, we want to help as many of our colleagues out there as absolutely possible.
So for example, you know how you're so in love when, you plan on getting married, you get married, then when the honeymoon's over, so to speak, and that you've lost that love and feeling, this will reignite your marriage and put you back into that love and feeling.
Outstanding. Well, thank you, you two, for spending some time with me today.